For my straight cath validation. So our patient is Mary Sanford, born on 11/12/98. She is a 26-year-old female who had just given vaginal delivery of her first child 6 hours ago. She does have a history of hypothyroidism. All of her vital signs are within normal limits. Her breath sounds are clear and she has normal bowel sounds. She did have a Foley catheter placed during labor. Due to an epidural placement, her Foley was removed prior to pushing, and she's been able to avoid since the birth of her child, which was 6 hours ago. She does feel bladder pressure, but is unable to void due to discomfort and the swelling of the perineum. We did go ahead and do a bladder scan, and there is urine in her bladder that she is unable to void. Due to that, the physician did order a straight catheter. She is alert and oriented ×4. Again, she does have that pain in the vaginal and perineal area from birth. She does rate it a 4 out of 10. And according to her chart, she does have no allergies, but we are going to double check that with the patient. Hi, I'm Katie. I'm your student nurse today. I'm performing hand hygiene and maintaining patient privacy. Can I have your name and date of birth, sweetheart?
Mary Sanford, 11/12/98.
Perfect, and that does match her wristband. Congratulations on having a child.
Thank you.
So you're still feeling that fullness in your bladder, right?
Yep.
Okay, and we did do that bladder scan, and it does look like you do have some urine in your bladder that we need to, let out. So the physician did order a straight catheter. Is that something you'd be okay with doing today?
Yes, absolutely.
Okay, and I did see you had a Foley catheter. It's kind of like that, except the straight catheter does not have a balloon in it. And once we drain the urine from your bladder, we will take it out. So it won't, it'll be fairly quick. Is that okay?
Yeah.
Okay. And you don't have any allergies?
Nope.
Okay. Specifically to latex or betadine?
Nope.
Perfect. I just wanted to double check because sometimes the catheters do have that. So I am going to have an aide come in here and do some peri-care. Is that okay?
Okay.
And I am delegating that to my CNA so that the peri area is clean before the insertion of the straight catheter. Okay, do you have any questions for me?
Nope.
Or concerns about that straight catheter?
Nope.
Okay, perfect. Then I am going to go grab that, okay?
Okay.
And then I am performing hand hygiene, maintaining patient privacy, and going back to here. So again, we do have that order for a straight cath for Mary Sanford, born on 11/12/98. We do have our straight catheter here. Due to recording of this video, it has been opened, but normally that would not be the case. You can see that it is not expired. It is a 14th French open urethral tray with vinyl catheter. It is latex free. It is prescription, and we do have that order from the doctor. So we do have the indication to use this because her bladder is full of urine. So we are going to go ahead and do this with the patient. So now we are going to go on in and we are going to do all of that kind of stuff. Hi, I'm back. Can I just have your name and date of birth, please?
Mary Sanford, 11/12/98.
Perfect. And that aide did come in and perform peri-care for you?
Yep.
Perfect. And we are just going to put the bed in high working order and making sure that this table is about my waist height or above, just so that is all good. Perfect. And then I'm going to make sure that there is a garbage in place, so we're not doing that. And normally this would not be the case, but we do have a red biohazard bag that we will be disposing of everything with. And I am going to perform hand hygiene again before doing the straight catheter. Is it okay if I pull down your blanket, sweetheart?
Yeah.
Okay. And then I am going to pull this down towards the edge of the bed and then pull this up. We can see that she does have the expected anatomy for the straight catheter, and for a female. We do see that swelling and redness because she did just give birth. That was also expected and known. Okay, my dear, I'm gonna pull you up your legs, okay?
Okay.
So we are just gonna place this in position just so we do have the correct viewing. If I didn't want another coworker in here, another nurse or another aide, I could have somebody shine a flashlight just so we can do that and see everything correctly to know exactly what you're doing. If this was for a male, it would be about 5 to 7 inches while inserting a catheter for female, it's going to be about 2 to 3 inches, or until you start having urine go through the catheter. Okay, I am going to put this down here just so I have it ready. And then I am going to have this open away from me. Again, if this was an actual case and not for the video, it would be a new package. So we open it away, and we want to maintain that sterile field. And then I just want to come up here. I want to just touch the top of the sterile gloves to make sure that everything is maintaining properly. I then can open it and open all edges, and we want to make sure that it lays flat. I do have that 1-inch border around the edge that I can touch that is not considered sterile, but I want to make sure that I do not touch the inside, because then that will be contaminating the sterile field. I am going to start with doing my right hand, so we will touch the outside of the glove and correctly put that on without touching the outside of the glove. And then we are going to go for the other one, and we are going to just touch the outside because we do have that sterile glove on. Now, since I do have these on, I am considered sterile, so I can only touch the inside of this. With that, I will drop it, keeping in mind that my hands do not go below waist level. I did drop it on the ground, but that is later date problem when I am not worried about a sterile field. So now I can now touch the inside of this package, but I need to make sure that I do not touch anything outside of it. We do have this first sheet. We have a shiny side and a not shiny side. So the shiny side is going to go down just because the other side is better for absorption. And kind of drop. I can still touch that middle just to make sure that that is in the proper placement. We then have the second sheet, which will go around the area. Again, the shiny side versus the not shiny side. Normally the holes on the edge are for the legs, but this is not properly, these don't properly lay unless I put it the long way on our patient. And we can see that, and everything is good there. Then I'm going to go from the inside of this. I'm going to put it here so I'm close and I have everything together. I will remove the top of this and tear off the top of this, the lube, but we are not going to be using that on the mannequins. But this is for the cleansing sticks. And then I also have the catheter and the cup for the specimen. So we are going to start with this, and I'm just going to remove all of those out. So now both of my hands are still sterile, but this is going to be my contaminated hand. So now this is the hand that I can touch the patient with. So I'm going to open, and I'm going to start this and go down. I want to make sure to contaminate it at least as possible, so I'm going to go around and not go across of it. I can then grab the second one and go this way and go down again and going out and around. And I can then grab my last swab and go right down the center, keeping in mind going out and around. And then I would normally dip the tip of this catheter into the lube, but because we are using it on a mannequin, we are not going to do that today. I am going to bring this up forward more, and then I do have this sterile, and I can insert the catheter 2 to 3 inches or until I hit urine. So we can now see that the urine is draining, so I'm going to allow that to rest for about 30 seconds or until all of it is emptied. Okay, we can now see that we have collected the urine. It is clear, no odor, and it does not have a cloudy-like appearance. I will then pull the catheter out, and then I can take this and put it, properly dispose of it. I can then now clean the patient up, perform pericare, but the sterile procedure part is over. So I can now dispose of this and take away the drugs. I am then going to don my gloves, but also properly tie this up before I do that and dispose of this where the biohazard goes as well. And then take off this glove, perform hand hygiene. Then I'm going to make sure that the patient is covered and comfortable. How did that feel? Did everything feel okay?
Yes, I feel much better.
Perfect. And no pain or discomfort during that? That wasn't expected, right?
Nope.
Perfect. And then I am going to straighten her legs. Normally that would be a little bit nicer. And cover her back up. And I'm going to put the bed in lowest position. Maintain that this colite is within reach and put up side rails if wanted, and bed alarm if necessary. I am going to properly document in her chart the amount, the color, the appearance, so if it was cloudy, not cloudy, or if it looked like there was blood in the urine, and that there was no odor. I will notify the provider that the procedure is done and make sure that everything is properly documented and in place and properly disposed of. Okay, Mary, do you have any questions for me?
Nope.
Perfect. If you have anything, or if anything starts to hurt again, or if you feel like you need to go to the bathroom, just let me know, okay?
Okay.
Perfect. I will see you later. And just maintaining that there's nothing on the floor and that everything is safe for the patient.